So glad you're listening to Health Power. This week I am doing a series, Suicide Prevention Month, this month in September. However, internationally acclaimed suicide prevention arts activist Dr. Diane Kaufman says every day is Suicide Prevention Day. So be sure to check out what we've already talked about. We've talked about the Hold On campaign. That was on September 10th. Yesterday, we talked about understanding suicide. Today, we're talking about prevention and intervention. And before we jump in, Dr. Kaufman wanted to talk about something that we did not touch on yesterday's show. Dr. Kaufman, welcome back.
Oh, thank you so much. So glad to be back.
Yeah.
Yes, I like to talk about societal risk factors
Sure.
to suicide, which again is in the context of the many risk factors to suicide. There's not just one thing that's going to cause the suicide attempt. And I'm using a reference from the CDC, Center for Disease Control. And they highlight, in terms of societal risk factors, cultural and environmental factors, such as, and this was the first one listed, stigma associated with help seeking and mental issues.
Yeah,
right?
so heartbreaking.
Yeah, so in terms of that stigma with mental health, that person's crazy, right?
Yes.
I don't like using these words, but they're a nut job, the nutcase, or just some horrible, demeaning, untrue, terrible way of talking about someone, right?
Yes.
So there's stigma related to mental health, which still happens.
Yes.
Even though there's been improvement, right? I think part of it may be that fear, a fear that a person has of their own losing control. So then they're projecting it on to someone else. But stigma, and just think about this, the combination of the two, the stigma about mental health, and then the stigma about seeking help.
Right.
It's like a no-win. Right?
Yeah. No, I've interviewed a woman that her husband, this years ago, committed suicide because he didn't want to get help for his depression. He was too embarrassed.
Yeah. So there can be, sadly and untruly, as it were, that idea of it's shameful.
Yes.
I can't seek help because it's humiliating. Right? Or I won't be a quote man. I'm not a man if I seek help. Or I'm not a strong woman if I seek help. Or if I seek help, then that really means what I'm feeling and thinking is real. So
that can be scary.
If I don't seek help, then it's really not so much of a problem.
Right. And I think you're stronger when you seek help.
Exactly. To seek help is a strengthening, strong, positive role modeling for yourself and others behavior. And also with seeking help, it can be the idea of, if I seek help, that means I can't solve the problem myself. So that means I'm even worse. I'm more hopeless. It cycles down in a very distorted way.